Dear students, now let us look into the module on basic and therapeutic diets. The term approach to nutritional care is to meet the nutritional needs and needs of the patient. It is a comprehensive approach by the core team of physician, the nurse and dietitian. At times, the other health professionals are also involved, such as a social worker or a physiotherapist becomes equally important in this cycle of the healthcare team. The role of dietitian is very much vital in the healthcare and is inevitable as she translates the nutrient requirements in terms of menu and formulas. You will be able to understand the purpose of modified diets in the healthcare profession, compile the different types of therapeutic diets in hospitals, and also plan suitable diets, type of diets in hospitals during the healthcare. The therapeutic diets are modified in three different ways in general. One for nutrients and two in the texture modifications may happen, and in third conditions for allergies and intolerances, the tailoring has to be done. Now, if we look into the need for these therapeutic diets, the therapeutic diets usually play a crucial and vital role to maintain the nutritional status of the person, to restore the nutritional status, to correct the nutritional deficiencies, to decrease the calories for weight control, and to see that to provide extra calories for weight gain, to balance the amount of carbohydrates, fats, proteins for control of certain conditions such as diabetes, to provide greater amount of nutrients such as protein, to decrease the amount of a particular nutrient such as sodium, to exclude foods especially during conditions such as allergies and intolerance, to provide textural modifications due to problems in chewing and swallowing that may happen. So, these are the different conditions where we usually think of a therapeutic diet. Common therapeutic diets include nutrient modifications. The first category, let us see about the nutrient modifications. We have different categories in this therapeutic diets, which is no concentrated sweet diet, which we call as NCS. So, these are usually given as diabetic diets when no added salt is added, low sodium is given, and low fat diet, and also low cholesterol diet, and this diet is usually given high fiber and is usually also prescribed as a renal diet. And now when we look into the components in the textural modifications, these are of two types, which comprises the mechanical soft diet, which is the bland diet, and the second one the puree diet. And when we look into the third component of therapeutic changes, the food allergy or food intolerance modifications, we have one for food allergy and the other for food intolerance. And the fourth category of these therapeutic diets go into tube feedings, which is usually the liquid feeds, which may replace the meals, and sometimes it is given in addition to meals. And also when we talk about all these additional feedings, we have two types of additional feedings, which is supplements and nourishments. Supplements are usually ordered as liquid nutritional shakes once, twice or three times a day, which is given either with meals or between the meals to increase the nutrient requirements. And sometimes the diets are given as nourishments ordered as a snack food or beverage item to be given between meals mid-morning or mid-afternoon. So, these all come into this category. And first is the nutrient modifications. When we talk about the no concentrated sweets diet, it is considered as a liberalized diet for diabetics when their weight and blood sugar are under control. It includes regular foods in the meal without any addition to sugar, and calories are not counted here and general calculations are based on. Now, the next category of diets are diabetic or calorie control diet. These diets control calories, carbohydrates, proteins and fat intake in the balanced amounts to meet the nutritional needs, control blood glucose levels, and at the same time have maintenance in the weight. Portion control is used at meal times as outlined in the exchange list for meal planning. Most commonly, we usually planned for calories as 1200 calories, 1500, 1800 and 2000 calories based on the requirements for calories and the other assessments. Now, when we move on to the next type of diet, which is no added salt diet, which we usually called as NAS diet. It is a regular diet with no salt packet on the tray, and food is seasoned as a regular food with no extra salt on the table. Low sodium diet, which is LS, may also be called a 2 gram sodium diet, and it limits salt and salty foods such as the processed, preserved foods, salty seasonings, pickles, salted crackers and so on, and it is used for people who may be holding water, edema in the body, and who have high blood pressure, heart diseases, liver disorders or the first stage of kidney diseases may be usually prescribed to this type of diet, which is the low sodium diet. Now, when we talk about the low fat or low cholesterol diet, is used to reduce the fat levels and or to treat medical conditions that interfere with how the body uses fats such as diseases of the liver, gallbladder or the pancreas. Limits fats to 50 grams or no more than 30% calories derived from fat. It is low in total fat, and at the same time the saturated fats contain approximately 250 to 300 milligrams of cholesterol. Next is the high fiber diet, which is usually prescribed in the prevention or treatment of a number of gastrointestinal, cardiovascular and metabolic disorders. Renal diet, this is usually for persons with kidney disorders. The diet plan is individualized depending on if the person is on dialysis or other treatments. The diet restricts sodium, potassium, fluid and protein at specified levels. And here, before going through these restrictions, lab monitoring and results has to be closely monitored. And these are the modifications done in the nutrients. And now when we move into the modifications in the texture, we have two types, the mechanically altered or soft diet, or the next one, the puree diet. It is the mechanically altered or soft diet is used when there are problems with chewing and swallowing. Changes the consistency of the regular diet to a softer texture, usually bland in taste, and which we call as a bland diet. Includes chopped or ground meats as well as chopped or ground raw fruits and vegetables, and it is for people with poor dental conditions, missing teeth, no teeth, or a condition known as dysphasia. The other type of diet is the puree diet. Changes the regular diet by pureeing it to smooth liquid consistency, and it is indicated for those who are weired with jaws, extremely poor dentition in which chewing is inadequate, often thinned down so it can pass through a straw. Common symptoms involving food intolerance are vomiting, diarrhea, abdominal pain and headaches. So when we go to the next type of modification, which is the tube feedings are used for people who cannot take adequate food or fluids by mouth orally. All our parts of the nutrient needs are met through these tube feedings. Some people may receive food by mouth or if they can swallow safely and are working to be weaned off the tube feedings. And the next type of modifications is during food allergies and food intolerances. Food allergies are due to an abnormal immune response to an otherwise harmless food. Foods implicated with allergies are strictly to be eliminated from the diets, and we call these diets as elimination diets. Appropriate substitutions are made to ensure that the meal is adequate and nutritious. The most common food allergens are usually the protein-rich sources, milk, egg, soya products, wheat, peanuts, fish and other products. Here in these conditions, usually a gluten-free diet would include the elimination of wheat, rye and other barley products, replaced with potato, corn and other cereal-based products will be a solution for this type of diet. And during food intolerances, modifications may be in such a way to lactose because of decreased amount of an enzyme in the body to digest the milk sugar lactose. Other common types of food intolerances include adverse reactions to certain products added in the food during preparation to enhance taste, color, or protect against bacterial growth. Common symptoms involve food intolerances are vomiting and diarrhea. Abdominal pain, headaches may also happen sometimes. So these are the different types of modifications done in general in the therapeutic diets. The type of diets in hospitals depends on the patient's needs and restrictions and is comprised of the following in common. They are regular diets, liquid diets, soft diets, restricted diets and therapeutic diets. Regular diets are called normal or house diets are used to maintain or achieve the highest level of nutrition to the patient who do not have any special needs itself to illness or an injury, while regular diets do not have portion or choice restrictions. They are altered to meet the needs of a patient's age, condition and personal beliefs. For example, a pregnant woman may require more calories and different nutrients than a young child would need, and hence these modifications are done in these regular diets. The next category of the diets is the liquid diets. Here we usually have the three types of liquid diets, which are clear liquid diets, full liquid diets and puree diets. Clear liquid diets include the clear water broth, clear juices such as apple, grape and other juices which are strained. Full liquid diets allow all the liquids in clear liquid diet plus the thick fluids such as milk, pudding, vegetable juices are also added in this second stage of full fluid diet. A puree diet allows all foods as long as they are converted into liquid form in a blender, and this is included as a puree diet. So these are all the liquid diets which are clear, full fluid and puree diets. Now the next category of diets are the soft diets. Soft diets transition patients from a liquid diet to a regular diet, and hence it is called as a transit diet. Patients prescribed on a soft diet are restricted to foods that can be mashed well, double boiled. This includes cooked fruits and vegetables, bananas, soft eggs, double boiled rices and tender meats. A mechanically soft diet allows most foods as long as they can be chopped, ground, mashed or pureed to a soft texture. This includes most raw fruits and vegetables or foods containing seeds and dry fruits as it may enhance the fiber levels. Next category of diets is the restricted diets. Restricted diets encompasses a variety of special diet that limit the amount of calories, fat, salt and other substances based on the patient's medical needs. For example, a restricted fat diet allows only low-fat versions of milk, cheese, cereal and ice cream, but does not place limits on the amount of fresh fruits and vegetables available seasonally, and patient may consume more. A restricted diet can also modify the other types of diets. For example, a post-operative patient with heart disease may be prescribed for a low-fat, full liquid diet. So these may come into the category of the restricted diets. Now, the therapeutic diets are used to treat diseases or illness. Like restricted diet, they can also be used to modify another type of hospital diets. The type of therapeutic diets include modifications in nutrients, modifications in calories, modifications in certain nutrients, proteins, carbohydrates, or diets that can increase the fluid intake and so on. Generally, these diets are divided into four: the clear fluid diets, full fluid diets, soft diets and normal diets. The clear fluid diet is a diet which is made up of clear fluid liquids, does not have any residue, and it is residue free from fiber or any presence of food particles. It is a non-residual diet. Now, when we look into the principle of what is this clear liquid diet, non-residue diet, and it is especially non-gas forming, non-irritating into the intestinal tract, non-stimulating diet, and clear fluids has to be given with amounts of 30 to 60 ml per feed and should be given at an interval of 2 hours on a day. The recommended conditions are, these are given for acute infections when there is intolerance for food, either as nausea, vomiting, anorexia, distension, diarrhea. In acute inflammatory conditions of the intestinal tract during post-surgical conditions, these type of diets, the clear liquid diet is the start of the diet to the person. Now, when the person accepts and tolerates with the clear liquid diet, the person is usually put on with the next diet, which is the full fluid diet. In this type of diet, which are liquid or which readily becomes liquid on reaching the stomach are given. This diet bridges the gap between the clear fluid and the soft diet. The principle of diet is, this is also a non-gas forming diet, non-irritating, non-stimulating, full fluid diet. And here also, if we look into the feeds, it is usually 30 to 60 ml per feed with an interval of 2 to 4 hours. It is recommended usually in the pre and post-operative conditions, during acute infections, diarrhea, and it is suggested for involving patients and the other persons. Now, if we look into the next diet, when the person is more suitable with this diet, next type of diet is soft diet. This is the diet most frequently followed in the hospital patients. It usually bridges the gap between the acute illness and the convalescing stage. The diet must be nutritionally adequate. It should be a bland diet, should be made up easily, simple to digest. Foods with harsh fibers and seasonings are usually avoided. Patients with dental problems, persons with acute infections, persons following a surgery, those who find it difficult to chew foods are often recommended with this soft diet. Now, when we go into the next type of diet, which is the regular hospital diet, it is the most frequently used diet in all hospitals. It is used for ambulatory and bed patients whose condition does not give a special diet of one or the routine diets. Many special diets progress ultimately to a regular diet before the discharge of the patient to home. The principle of the diet is that it should be a well balanced and a nutritionally adequate one. It should provide with a minimum of 1500 calories to the maximum of 2000 calories, 40 to 45 grams of protein and adequate vitamins and minerals. Here we have pre and post operative diets. The objective of this pre-operative diet is to improve the pre-operative condition whenever the operation is not of an emergency nature, and also maintain or correct the nutritional deficiencies before operation or injury as far as possible, and also to avoid harm from injudicious choice of foods. Following the surgery or injury, the needs for nutrients is greatly as a result of loss of blood. The plasma or pus formation would surface, hemorrhage from gastrointestinal tract or pulmonary tract. During immobilization, loss of some nutrients such as proteins may also be accelerated. A fairly simple operation often involves moderate deficiency in food intake for few days. Following the operation, some nutrients may be supplied by parenteral fluids, but the full needs of body usually are not met by the means alone. Adequate oral intake is also often delayed for considerable period following the surgery or the other infections. Metabolic losses of great and alternative methods of nutritional supports are necessary. Food and fluids are generally allowed until midnight, just passing the day of operation, although a light breakfast may be given when operation is scheduled for afternoon and local anesthesia is to be used. It is essential that the stomach may be empty prior to administering anesthesia so as to reduce the incidences of conditions like nausea, vomiting, and subsequent danger of aspiration of vomit that may happen during the surgery. When an operation is to be performed on a gastrointestinal tract, a diet very low in residue is given 2 to 3 days prior from the operation as well. In acute abdominal conditions such as appendicitis, cholecystitis, food is allowed by mouth until nausea, vomiting, pain or distension have passed in order to prevent the danger of periodontitis. The complete nutritional support are provided by conventional intravenous feedings, catheter, jejunostomy, total parenteral nutrition, tube feedings or semi-synthetic fiber-free diets. After subsequent recovery, diet is planned accordingly and a high calorie, normal protein, low fat, high fluid, non-residual diet is usually prescribed. And now when we look into the principles of all these therapeutic hospital diets, these are certain principles that is followed in the diet therapy. One important aspect that is that all therapeutic diets are adaptations of the normal diets and skeletal structure of the requirements of the healthy person. The person is change of a dietetic planning also must consider the patient as a person, and consideration must be given to the economic status, dietary pattern, likes and dislikes, the environment of the family, preferences, religious status and availability of the food items. Dietetics must always give more time for flexibility, and rapport with the patient is essential to make the dietetic regimen a success. As a rule, therapeutic diet must be easily digestible, soft, liquid, clear fluid or bland based on the conditions. Best sources must be selected to ensure maximum utilization of nutrients from the foods consumed without disturbing the intestinal and other parts of the body, because as a whole a patient has a poor appetite. Along with the discomfort of the disease, it is always difficult to implement, and cooperation from the patient is very much essential for the success of the diet therapy by the dietitians. The patient must be well educated on the importance of modifications in the diet for quick recovery and its consequences for the person of the uncontrolled diet in special conditions. The dietetic history of the patient must be studied thoroughly and collected to know of any intolerances of food or allergic in the patient's working conditions, and dietary habits at workplace must also be considered before planning the dietary instructions to the patients. As a conclusion to this module, we have just seen an overall view on the different types of diets followed in the hospitals as basic and therapeutic diets. Common modifications in the diet therapy are changes in consistency by adopting a full fluid diet, clear liquid diet, nasal feeding or tube feeding or soft diet. Changes in the preparations are made by avoiding condiments, spices, suggesting a bland diet which is chemically, mechanically, thermally non-irritant in nature. High calorie diets are also prescribed for underweight persons or during fevers or during hyperthyroidism. High proteins are usually recommended for protein calorie malnutrition, cirrhosis in the liver, peptic ulcer, tuberculosis, conditions such as typhoid, nephrotic syndrome, celiac diseases, and during pregnancy and lactation. The same way, low protein diets are usually suggested during hepatic coma or failure, kidney diseases like uremia, nephritis. Fats are restricted in low calorie diets in liver disorders and are also necessary for fat in steatorrhea, malabsorption syndrome and in undernutrition. Such as these modifications in general may be applied in the hospital situations. Similarly, a mineral like calcium is essential in treatment of rickets and osteomalacia and is restricted in terms of a renal calculi. Sodium is restricted in conditions such as hypertension and also in cardiac diseases. In kidney diseases, if we see, also we have sodium chloride restrictions. In all these therapeutic diets, a high vitamin and mineral content in the diet should be increased to remove constipation, while it should be reduced in peptic ulcer, ulcerative colitis, celiac diseases, diarrhea and dysentery. The same way, when we talk about the chemical constituents like purine or restricted in the treatment of a gout, low oxalic diet is prescribed for renal calculi. Diet consistency is often modified depending upon the nature and condition of the patient during these diseases. Planning is accordingly done and tailored, customized personally depending upon the nutritional status of the patients by the healthcare team, and hence it is a comprehensive approach by the healthcare team comprising the physician, nurses and dietitians.